And now we're going to talk a little bit about touch as a cue during the birth. Women do like to be touched when they're giving birth, whether they labor or have a non-laboring cesarean. But they want the touch to be how they like it, at the right time, and the right place. Your touch often with your partner is either sexual intimacy or it's things like cuddling and stuff like that, which is quite passive. Touch during birth, you can use it as a cue to help her soften. No matter what a woman looks like on the outside, you actually, as you know, do not know what she's thinking about on the inside. So a woman can look very contained and she can be seething. And women who are facing this monumental gateway, as women, we are hardwired to have fear about it. Women have always given birth, but that doesn't mean that women know how to give birth, nor does it mean that women can control the safety factors. The medical profession developed around trying to control the safety factors and to control the pain factors. With skills, you can control the pain factors. With skills, you can reduce and prevent some of the issues that can become problems. You're 36 weeks to birth at this point. And at this point, what's important for us and at Common Knowledge Trust and our Birthing Better Families is to give you some skills to help cue your birthing partner so that she softens and she relaxes and that she doesn't delay the birth of her baby because internally she's tight. Men get that giving birth is an exercise in plumbing. It's a big object that has to come down through and out a container, and that's the body. And if you tighten up down there, it's going to hinder the ability of that object to open you up. So if she's tight inside where you can't see it, the same hindrance will occur. So we want you to know how to touch. If you rub her like this, she may be very irritated. So what we want you to do is to place your hand on some part of your body and just rest it there. So that's ultimately the touch that we want you to use. Now what we want you to do is to just slowly go down until you meet resistance. That's as deep as you'll go on her body as well. And then you want to slowly, 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 slowly raise your hand back up to that resting spot. Now, what we did was to teach you the motion. Now we're going to combine it with what you do. So you're going to rest your hand, you're going to press down gently until you find resistance, and as you slowly lift up, you soften under your hand. Soften inside, under that touch as it's rising. That's how you help a woman cue to softening. Put your hand on your pelvis, your hip, just above where your leg is, and just press in until you find resistance. And then slowly let go, slowly, slowly, and soften inside under your touch. And that softening will spread to other areas, but you can feel it. And it's a lot easier to feel it when you're just doing it and not listening at the same time. Practice that. Show her how to do it on herself. Have you do it on her. Have her do it on you. And then you always have a touch that can help either of you soften and relax. And during the birth, you mostly, if it's labor, you focus on the sacrum, the bone at the end of the spine, the back of the bum, right above the legs, and the lower belly. That's where your baby has to come through. And then the next place is on the legs, because the legs are weight-bearing, and that tenses up our muscles and connective tissue. And then sometimes, of course, on the shoulders, and even the back and the front of the head, just to soften and help a woman soften her brain during the process. If you're having a cesarean, you can do it as you're driving to the hospital, resting your hand on her leg, on her thigh. When you get in and she's been prepped, on the shoulders, on the face, on her arm, and then you will have a communication of touch that will be invaluable, and you'll remember it forever after the birth.